I appreciate the opportunity today. My name is Dan Paoletti. I'm the Chief Executive Officer of the Ohio Health Information Partnership, which also manages the CliniSync Health Information Exchange in Ohio. This testimony is as much about technology as it is about community collaboration. We are a nonprofit 501c3 organization created in 2009 from the ground up by stakeholders from across the state who really felt that the need for a robust health information exchange infrastructure was key to lowering cost efficiency and providing better care. Ohio is a microcosm of the nation. We have a population of almost 12 million patients. We have 12 million people. Those people occupy farmlands, Appalachia, and multicultural urban centers in our major cities. The challenge of leveling the playing field around the technology first appeared very daunting, but a multi-pronged approach was implemented. We spent many years helping over 6,000 primary care physicians in collaboration with many community stakeholders to adopt electronic medical records, while at the same time putting in place the Health Information Exchange CliniSync, which was created in cooperation at first with hospitals throughout the state. We now have over 157 Ohio hospitals, many competing with each other in their environments, participating, which has created an interoperable environment for patient health information in Ohio. This approach has enabled the network to quickly become financially sustainable and resulted in a medical community that now electronically exchanges patient records instead of using paper. In Dayton, we've partnered with the Wright-Patterson Air Force Base, the Department of Defense, and the Wright-Patterson Medical Center to use the CliniSync services to enhance interoperability to help active duty members, the troops, their families, and their veterans, and we are currently testing with the VA. The philosophy in Ohio is that the record should follow the patient. The community health record allows authorized treating physicians to access a patient record no matter where they had care. To date, almost 13 million individuals have a community health record in Ohio, and the consent policy allows patients to be included unless they choose not to and opt out. Another important innovation enables notifications to physicians if their patients are admitted to an emergency room or admitted as an inpatient in discharge. These notifications allow for quick follow-up and intervention if care can be provided outside of the hospital. Since late 2016, almost 7 million notifications have been sent to providers. An example of notifications where notifications have helped with intervention was for one provider who received 3 alerts in the same day on the same patient from 3 different emergency rooms, indicating possibility of opioid addiction. These notifications allowed for proactive steps for action with that patient. University hospitals in Cleveland are working with dialysis centers in Cleveland to coordinate care of over 12,000 dialysis patients when they hit the emergency room. An alert is sent to the community nephrologist. They work with the emergency room to reduce some of the tens of thousands inpatient days that are accounted for by those dialysis patients. There are lots of stories I could tell you. We could spend a lot of time talking about innovation across the state, but I'd like to spend the remaining time just with a few suggestions on where you might be able to help. When it comes to innovation ideas, coordination, as CMS moves to alternative payment models, the importance of implementing efficient care and case management is critical. Look for those efforts that are already working. Telehealth and remote monitoring is key and continues to emerge as an important solution to hold the possibility to impact significant challenges such as cost and access. Quality reporting. In the past, payers have defined quality using multiple different metrics, resulting in a very expensive, burdensome, and unnecessary administrative task. Harmonizing those quality standards across the payers and providers is an important step. Behavioral health. There is a significant need to revisit rules allowing for data sharing restricted by CFR Part 2, CFR 42 Part 2. These patients have some of the most significant needs, and if they want their information to be shared, we should allow that. House Resolution 3545, Overdose Prevention and Patient Safety Act, that I know some of you are involved with, is a very important step forward. Primary care initiatives. Continuing to fund innovation that puts a primary care provider in the front has allowed Innovation Ohio to really move forward. And with that, I will pause and allow questions later. Thank you.